Hi, I'm Dr. Robert Meislin of NYU Langone Health, describing a newer technique for repair of a partial thickness, supraspinatus, infraspinatus, or POSTA repair in the shoulder with use of the BioBrace. Patient is a 75-year-old female, history of fall, outstretched right shoulder with resulting right shoulder pain and weakness. It quickly became refractory to conservative course, including physical therapy and injection. Physical examination showed forward elevation limited to 160 degrees, external rotation to 30 degrees, internal rotation of T11, abduction of 90 degrees. Her resistive strength was diminished at 4/5. Imaging showed normal-looking glenohumeral joint on X-ray with no calcifications. MRI showed a high-grade interstitial partial thickness supraspinatus and infraspinatus tendon tears. With the patient in the lateral decubitus position, a second needle is driven through the supraspinatus tendon and passed with the number 1 PDS suture, which is then retro-shuttled with passage of the non-absorbable suture, creating a mattress stitch on the undersurface of the supraspinatus cable. A second set of sutures are passed in similar fashion through the 7mm cannula that acts as a conduit for passage of the suture. The subacromial space is then visualized with the 2 sets of sutures on the bursal surface of the rotator cuff, which is intact. The BioBrace is then brought into the subacromial space on top of the bursal surface, with the BioBrace brought through a 10mm passport cannula. The sutures are then tied down and secured on the bursal surface. The lateral row is then debrided, allowing for knotless lateral row repair and security of the BioBrace on top of the rotator cuff. An anterior row anchor was placed, followed by this posterior knotless anchor, allowing for proper tensioning and migration and mobilization of the tendon that is brought more laterally with compression of the BioBrace on the bursal surface. This creates a transosseous equivalent repair for this POSTA tendon tear. Visualization through the midlateral acromial portal shows excellent compression of the BioBrace on the bursal surface. The arthroscope is returned to the glenohumeral joint, showing reconstitution of the undersurface of the supraspinatus tendon.